Okay, good morning, everyone. Welcome, Larimer County. Today is Monday, July 29th, 2024. This is our morning work session regarding performance measures for the service area that we refer to as the Human and Economic Health Service Area. We are scheduled to go from 10 to 11:30 a.m. and my name is John Kafalas, Commissioner from District 1, joined by my Commissioner colleagues, Kristen Stevens from District 2, over there, and Jody Shattuck-McNally, Commissioner from District 3, over there. And of course, we have our County Manager, Lorinda Volker. And at this time, I will turn it over to Julie. If you would introduce yourself, please. I'm sure you know the routine. Cue this up and, of course, introduce your colleagues or however you see fit.
Thank you. I'm Julie Elser, Data Program Manager, and today we're hearing from the Service Area for Human and Economic Health to present their performance measures. I just want to point out that we also have a strategic plan objective that is looking at kind of reworking and improving how we do our performance measures. And so these might look a little different in a year from now. So just wanted to point that out. We have 5 departments presenting today. So we'll plan for about 15 to 20 minutes for each department. And we will begin with behavioral health. And I'll pass it over to Amy.
Good morning. It's nice to be with everyone this morning. Amy Martonis, she, her. I'm serving as the Director of Behavioral Health, and I'm happy to be with you this morning. Jumping into our performance outcome measures, we'll begin with the percent of revenue spent on behavioral health services and programming. You can see that our goal is to spend less than 10% of our revenue on overhead expenses for BHS services, and we are meeting that goal, with the primary internal expense being our personnel costs. When we look over to the Impact Fund grant objectives being met, you can see that we're at 84%, and I'm happy to talk about this for a few moments and take any questions. We're currently working with 35 organizations around their grant objectives through the Impact Fund, and we recognize that this goal was set before we had any of our impact dollars out the door or any data from organizations to help set this goal. So it's something that we're looking at and continuing to evaluate, and we're paying attention to it. We have seen a trend across organizations that have workforce development objectives outlined, that right now recruiting in human services and in behavioral health fields has some unique challenges. So I think we see that reflected here. It's also important to note that most of the 2023 grantee performance periods end at the end of September, so still in process currently. From our 35 community partner agencies, we have 3 amendments in this cycle so far. That includes 2 no-cost 3 months extension to the work and 1 budget amendment, but no reverted funds to date. Another thing I would just identify here is as we look at future directions, we've had an important vacancy on the behavioral health services team in the implementation manager role. And we're looking at and considering as a future direction, how can someone filling this role provide important agency support around aligning objectives, goals, and how we're measuring these outcomes. So becoming additionally thoughtful and looking at how we are assessing how these objectives are being met. Any questions so far? Should I go through each of the slides? No questions?
Amy, why don't we just go through the slides
Okay.
and then we'll certainly open it up for a conversation.
Great.
Thanks, Amy.
Yeah. The next one is suicides in Larimer County, which we can see has had a marked reduction. And obviously, this reflects a very complex behavioral health issue with a lot of inputs and partnerships and efforts that are reflected in this. And I think it's notable and important to name that we have had an infusion of funding through the behavioral health dollars into community partner work, and that certainly seems to be an important thread to name in looking at that reduction, and a really significant marker in terms of performance outcomes for our county, and something to celebrate. Lastly, we have the emergency department usage for mental health complaints and for substance use. And we can see those numbers being fairly static overall, and recognizing that this is community level and macro data looking at UC Health and Banner reflected there. And I have a lot of curiosity about what this is going to look like as we move forward into another year with utilization of Longview. So I'll be curious to see what that looks like as we look forward. Those are my comments for the commissioners, and I welcome any questions and dialogue.
Thank you very much, Amy. Colleagues, any questions, comments, observations? Commissioner Shattuck McNally.
Thank you. Welcome, Amy. Appreciate you being here and presenting this data. I'm very curious about the emergency department usage for both mental health and substance use disorder complaints. Just wondering, as we evaluate this, and we have some other groups working on collecting all this data together, if we need a different, I just suspect these numbers are a little low, and I'm just wondering if we maybe have a chance to look at some other, there he is. I was just going to say, Dr. Gerald Olson's working on some groups, things together, and maybe we need to look at some of that. I would, just wondering, because those numbers seem a little low to me, especially after, during 2020. In 2021, we knew that the pandemic had seen a very large increase in substance abuse overdoses, and so I'm just curious about this, looking back at this, and also we don't know, is this alcohol together with opiates and fentanyl, and I'm just curious about this, and not a criticism. I think there's some curiosity here to really look at this a little bit more in depth. So, and I do agree that the impact grant objective doesn't seem to have gotten close, but not quite met. And I'm wondering, do we know of other grant programs through other organizations where what kind of goals they set for their grantees if they didn't meet because it's meet all the objectives, I'm assuming. So maybe they met 90% of them, or maybe they didn't meet, so I just, that's kind of doesn't tell the full story, so I'm curious about that as well.
Yeah, absolutely. Thanks for those comments and questions, and I think there are questions our team is asking as well to look at further and to understand more comprehensively some of these trends and items that are reflected.
Great, thank you so much for listening to my curiosity and comments.
Absolutely.
Thanks, Commissioner. Commissioner Stevens.
Yeah, so talking about the impact grant, do we feel like, I guess, you probably, I know you're new, so but I'm thinking about sort of our smaller nonprofits having a harder time. Are the goals not achievable, and we need to kind of help them with that? So, we don't want to not fund people because they're not achieving their goals, because maybe they need more help achieving their goals, right?
Right.
At the same time, we like to see those numbers kind of up there, and so how can, I guess I'll just ask you to kind of see what the landscape is and see what you're thinking as you kind of dig deeper into these this grant funding, and how we can just kind of hit our goals of 90%, and how we can help them hit their goals as well. So
Absolutely, thank you. I am looking forward to exploring with our community partners how those current goals and objectives are being set, and all the different measurement efforts, and where can we create some alignment across our priority areas of service provision, and ensure that folks are setting objectives that align with the work that's being done, offering some of that partner thinking and co-strategy, particularly as we fill that implementation manager role that's currently vacant. It seems like a great opportunity to extend that support and revisit the model for how we're assessing those outcomes.
that's great, thank you, and I appreciate, not looking for any kind of punitive approach, right? And I know you aren't either, but just like, yeah, can we get there? Can we get to that
Yeah.
90%, and
Yep.
can we help people? And then, obviously, we've heard these numbers. Commissioner Shattuck McNally has mentioned the drop in suicides several times, but that is really great that we're seeing those numbers get lower, and hopefully that is a trend to get to zero. So thank you.
Thank you.
May I make a comment about that, sir, if you're obliged?
Yes, of course, sir. And then
I appreciate that from the commissioners. And if you all recall, when it comes to the suicide, that's been a tremendous community effort under the Community Health Improvement Plan, the community's plan to reduce suicides. And as we move to the next 5 year with the Community Health Improvement Plan, really looking at loneliness as an epidemic and how we create more social connections such as CHAC 212 and other connections for LGBTQIA and veterans and people of color. That is a direct indicator of the community's work, and we've got over 60 partners working in this effort. I think that's extraordinary, and we are one of maybe only county in the United States has had 5 years of trending downwards in suicides. I was at a national conference and our name came up because of this, so this is extraordinary work with extraordinary people doing extraordinary things. So I just wanted to add that it's a huge community effort that is really driving these numbers down. Obviously, we want to be zero, but hopefully it just keeps going down.
Thank you, Tom. I have two questions and or comments. The first one is, well, regarding the decline in the suicide rate, I think that is indeed very encouraging, and it is a complex issue, and there are a variety of partners and resources and inputs that are helping to achieve that. I wonder if, Amy, if you could just remind people of our behavioral health services website and how that intersects with our community health well-being, community health well-being and resiliency website, because I think this information is broken down in great detail to show different age groups and how suicide rates have changed. So I wonder if you could speak to that, please, and I have one more comment.
Yeah, absolutely. I think the tremendous amount of resources that are available to keep the community informed are available online, and also with community partners in terms of data dashboards, not only through behavioral health, but our other community partners and organizations doing this work. And there are connection points for access to services as well, both immediate care, urgent care, and connecting for behavioral services over the continuum to support that well-being, which I think is part of this, right? Is part of preventing suicide and offering that support.
So if somebody wanted to access either of those websites, what is the link? Do you happen to have that in?
I can pull that up.
And maybe Tom, or do you know what the link is for the?
Larimer.org/health. You'll get right on our front page. It'll say Health, Wealth, Resilience.
And Tom, make sure your mic is on. Would you repeat that, sir?
Larimer.gov/health on the main page. There's a click right to the dashboard.
And Commissioner,
Yes,
if I
of
may?
course, Laura.
Laura Walker, Human and Economic Health Director for the county. There is also a direct linkage from the BHS website over to the health website, because the one thing we wanted to make absolutely sure as we built that more comprehensive dashboard is that we weren't duplicating efforts and having the same dashboards in different places on our website. But there is a clear linkage from the Behavioral Health Services website for the county over to health for that information.
Yes, and that is Larimer.gov/behavioral health.
Thank you. Before we go to Commissioner Shattuck McNally, I do have one other comment perhaps, and if I wait too much longer, I may forget it. And that is, I believe I've spoken to you, Amy, and I believe I've spoken to you, Laura, regarding the impact fund grants and how we get the word out. And I think part of what I've heard back is some of that is a capacity issue, but I think we've at least had a conversation about how we might try to reach out to other organizations. I wonder if you have any additional thoughts about that. Is that a good idea, or do we just stay focused on the ones that have been in the queue for a long time?
Yeah, that's a great question. It feels important that the whole community is aware of the process and the availability to apply for an impact fund grant. That cycle, that application period has just concluded for this next award year. But the information and the instructions for how to apply, the backstory of these impact funds are available on that same website that I named, larimer.gov//behavioral health. And I think our team will look at and construct a communication plan around ensuring our community partners are aware of the next cycle moving forward, looking at the different communication efforts we can make.
Yes, Laura.
Thank you, sir. Just to inform the board, at this point, we received more than 80 applications. So we've once again broken our record. We had 78 applications last year for this program, and so the number of applications continues to increase. I think where we are finding the most space for creativity and how we do the best work with this is to really align our criteria properly so that we can fund the most effective programs that come through that process, but also consider whether or not we need to fund a higher level of resources to that program in future years to be able to include more of these great programs that are coming our way.
No, thank you, Laura. And very quickly, and then we'll go to Commissioner Shattuck McNally. Yes, that's a good point. And 80 organizations applying suggests that we're doing something right, getting the word out. So that's a good thing. And then thanks for reminding us that I think we wanted to get a year or so under our belt regarding the behavioral health facility, and that we would have a conversation about whether or not we should increase that dollar amount and whether or not we can increase that dollar amount. Thank you for listening. Yes, Commissioner.
Well, I have two things to say now, Commissioner, and thank you, Laura, for mentioning that. But as I understand, all along as Chair of the Policy Council and been involved with this effort, there's hundreds of people on the email list that this goes out to every year to reach out to be informing of the cycle and the availability of this funding, as I understand. And this is a cross-section of lists from lots of different providers. Also, over the very successful 5-year history of these grants, impact grants, there have been over half dozen, if not more, of new organizations, especially with peer-to-peer things that were not on the books and were able to receive funding and somehow knew about this and were able to be reached out by all these organizations and are still on that list. And so that was a risk to take to fund a new organization. But as I understand, most all of those are still going forward and doing very well. And this funding was kind of their initial start kind of grant, including a veterans organization that I think is still doing pretty well. And I think nationally getting asked to go to Washington, D.C. now to present. And so I think that's very important for the public to know that it's not people who are in the queue. Every year it's a new, fresh start. And everyone has to go, there's hundreds of emails that go out and lots of opportunities. And then people will choose to apply. And then there is a very robust process for these impact grants that have a staff that meet certain criteria for financial sustainability and so on. And by the end of that process, when it comes to us before as a policy council and then our recommendations to the Board of County Commissioners, which is us, usually over 80 people or more have looked at this, evaluated it, and scored on a criteria. So it's not just a few people, it's lots of people. And these volunteers are subject matter experts throughout the community, and they volunteer lots of time. Usually takes 30 to 45 minutes for each that we've been told by them to evaluate each application. So I want to just make sure the public knows that there is a tremendous effort reaching out to the community. There's a very robust and long process to score these, and that it is something that takes a lot of staff time and commitment. And to be able to do that from June to about August, that's a pretty quick turnaround, and I just want to commend all the who are involved. They're very dedicated and very focused. So my next question then, so I just wanted to address that, was the, yes, socialization. My daughter and I are talking about in 2017 with intergenerational conversations. We're also looking at older adults who are talking about this. We're talking about this in the fentanyl opioid abatement space. We're talking about this in the school spaces. This is something that we're working with together across a broad section of agencies and sectors. And I think this is really important to make sure that we're all connecting those dots and making sure Because not only do the children and the youth need to be connected, but their families and their parents as well, or their grandparents who are struggling. And I think that this is really important to know that we're funding those through behavioral health impact grants, the opioid abatement money, and so much more. And even older adults, the Office on Aging is funding these. So it's really kind of a great way to maybe see how we can leverage those and maybe overlap them. And I do think the work that Dr. Gerald Lorson and I and others are working on in the health department on making sure that we're taking all of this data with all these different sectors, including from the school districts, there'll be abatement, behavioral health, back grants, and we're trying to pull that all in together into one dashboard so that we can leverage these resources, because this is a long-term effort and we need to make sure that we're trying to work together and break down those silos. I call it the Larimer way, you've heard me say that before, and keep leveraging that together. And I want to thank everyone, because there's a lot of people at this table who've been really supporting that effort, because I think this is one of the ways we're making a difference, is that we're trying to work together and see what we can do together. So thank you, Mr. Chair.
You're welcome, and thank you for sharing the good news regarding, and the details regarding the Impact Fund grants. And also thank you for correcting my comment about organizations that may be in the queue that are the only ones. It's important that we provide accurate information to folks. I think we'll move on. I was going to check in with Lorenda, but I think we'll move on to the next.
Can I ask one quick question? I'd have a very quick question.
Yes, Lorenda,
On
please.
the last two slides, the emergency department usage, that is the percentage of billing that was done for those services? Is that how that is reported? So, yes. So it makes sense then, in a year where there were a lot of COVID-19 hospitalizations as well as mental health, that number would look low because the emergency rooms were overflowing. So that's not necessarily a concern. That's more of a pattern. Okay. I wanted to make sure I was reading that right. Thank you. Thank you, Chair, Mr. Chair.
Yes, Lorenda, thank you. Thanks, colleagues in the behavioral health world. Let's move on to our next department. Julie, please.
Yeah, we can move on to economic and workforce development.
Good morning, Commissioners. Mark Johnston, Larimer County's Economic and Workforce Development Director. Thanks for having me. Kind of walk through our 5 data points here, but maybe to begin, sometimes I like to describe our department's service footprint as a 4-legged stool. 3 of those 4 legs are really represented here. The 4th leg, our climate core, our conservation core, is not. But as Julie and the team works on some new data metrics for us possibly in coming years, we'll make sure to include that 4th leg. This first particular part of that stool focuses on our Veterans Service Office, the VSO that we support here in Economic and Workforce Development. And what this is showing us is average number of days that it takes for a veteran to wait for an appointment. Be assured that appointment, it's more often in person, but it's also available via phone, via Zoom, so that we can be as convenient for the public. You can see the trend down from 22, from 10 days to 23, 5 days. So we split that in half. And I think that tells a couple of stories. One is back in August of 22 through August of 23 was the surge of the PACT Act. So much of 22 data shows that surge. PACT Act, again, just a reminder, helped expand benefits, healthcare benefits for veterans exposed to burn pits and toxic substances, most namely Vietnam era, but then also Middle East. So that surge, you can see kind of quieted, for lack of a better word, wasn't as much. And then we also have helped reskill, upskill, next skill one of our internal staff to see veterans through benefit claims. So our staffing pattern kind of right-sided as well. So that's our Veterans Service Office. The next two charts, median quarterly earnings after 6 months following workforce center services, and then the employment retention after 2 quarters from those receiving workforce center services really drill into a particular part of our second leg of the stool called the public workforce system, the federal legislation known as the Workforce Innovation and Opportunity Act. So imagine a part of that service focuses intensive case management on some different populations. And this particular sets of 2 graphs focus on laid off workers, more commonly known in the law as a dislocated worker. And we can see that of those dislocated workers who received intensive case management services, that upon exit, 2 quarters in, or at that 4 to 6 month mark, that worker was earning $12,017 in a median type of metric. So imagine 100 of those candidates lined up. We pick the 50th person, and we stand up that wage as our part of our common measure. Additionally, you can see that we've raised in the last year the number of dislocated workers who have continued to work. It's a retention measure of those who've left us. 81% of those have continued to maintain employment, typically in that same employer. So two common measures under our Workforce Innovation Opportunity Act. And then the last 2 slides focus more on our business and economic development work. You can see in 2023, the regional economic development team, literally 30 plus municipalities, partners, counties in this space, served over 200, specifically 219 surveys were obtained. I think some interesting themes from those surveys were interest rate uncertainty is still problematic for businesses. But then the other 2 highlights really fell back into talent acquisition. As we heard from our behavioral health director, that is really cross-cutting across all businesses, and it's really access to a skilled workforce. And then it's also, some executives are almost calling it needing to staff up at a higher amount of staff to then forecast workers who, for one reason or another, are taking more sick days, more leaves of absence. So they still have that business to run, but historically they've been able to run it at a certain FTE margin. Now they're seeing they need to increase that FTE margin. So an interesting dynamic there happening. And then the total number of business attraction projects. This is one of the hallmarks of the Regional Economic Development Initiative is attraction. And this group has fielded nearly 60, 57 unique site selectors from, frankly, across the world, some international, mostly national, to see if Northern Colorado is a good place to come and move and do work, do business. So you can see that trajectory continues to grow. So Northern Colorado is more and more on the map for this type of work.
Thank you, Mark. Well done. Let's begin with Commissioner Stevens. Do you have any questions or comments,
I
please?
do, thank you. Thank you, Chair. Well, thank you, Mark. This is, I think this is mostly really good news, so it's great to see this. With the median quarterly earnings chart, is that, with your goal of $8,750 quarter, is that something that's dictated by the federal government?
That's more of a, thank you for the question. Sure. The federal government provides their baseline to the state of Colorado, and then the state of Colorado negotiates that. So we'd call it a state measure. And then the 10 workforce regions are responsible for collectively getting to that number.
So does that number is increased over those years? So, Okay.
It continues to increase.
okay, just because I was like, well, it doesn't go as far as to.
Yeah. As a matter of fact, we begin negotiations in about a month with our 10 workforce regions to land on our next baselines for the next 2 years.
And so with dislocated workers, what kind of work were people previously doing and what kind of work are they finding? Are they finding work that is similar in pay and, just because I'm not sure what that looks
No, I
like.
think that is a fascinating question, and I think it's a little bit of everything. So, we've seen layoffs across all sorts of sectors, and then we're reskilling in occupations really that still have a labor market in the area, but also are really unique to the person's talents, their skills, their transferability. So it ranges across IT, across project management, manufacturing. I wouldn't say that all increase their wages, because we do have some folks who, as they're trying to reimagine, they do make conscious decisions to enter a occupation that may not have the same wage mobility. For example, an engineer who wants to be a teacher. So we really do see a wide variety.
Some of it's quality of life and some of it is.
Yeah.
Yeah, okay. Did you read the book Janesville? That's an interesting book because it really talks about like, as we're doing that work, upskilling and stuff, are people moving from a manufacturing job into a service job and then not making, enough to pay their mortgage or send their
Yep.
kids to college or whatever. So you feel like you're not necessarily seeing that in our.
So I have not read the book, but I think it's a critical question to just evaluate the effectiveness even of the federal system. One thing we're trying to do more and more in Larimer County and in Colorado is really adopt a framework of quality standard. There is a definition at a state level, but then rally industry partners on the front side of training to do more cohort training into occupations that are more livable wage.
Well, thank you. I appreciate you being conscious of that, and that clearly you would be in your field, but just wanted to, and I think about the staffing up for, this sort of increased leave of absence and time off, and I wonder if that's a reflection from the pandemic of people understanding that time off is important and that the hustle culture might not be for everyone and that we all need time to rest and recuperate and we don't have to go to work sick. And so do you feel like that has anything to do with it, sort of ideas about work and your relationship to work
do.
changing?
I do. I think employers are more cognizant also of wellness, trying to model that. And with that said, still finding that balance of getting product to market, getting services. So it is a fine balance, but I think the pandemic absolutely plays a factor in that.
Great, thank you.
Thank you, Commissioner. Commissioner Shattuck McNally.
Thank you. Great conversation. So my question was, and the thoughts on the total number of business attraction projects. Certainly, that number has increased since we've been on the board. And so that is obviously great work on behalf. So it's kind of a loaded question. Maybe there's not answers, but there's some supports and some reach out with us as commissioners with your, with working with your department, the NOCO Ready initiative, supporting kind of some of these new chambers of commerce and some of our immediate needs grants for the small business supports we had. Is this a mixture of, so really we have been attracting new businesses. We don't need, it sounds like that's going well. It's not something we need to fix, but maybe just support. So is it a mix of strategies, collaboration? Is it just because we're growing in this area? Just curious about that.
I think the partners are investing more time, energy, marketing collateral in the space of site selectors work. So I think that's driving it. I think population growth, I think quality of life, Northern Colorado is doing that as well. So, yeah.
So a little bit of everyone working together in the same direction and collaborating?
That's right.
or is-
That's right.
Okay.
So being a little bit newer to the economic development space, I oftentimes hear this concept of it's a team sport, and it really is. As a matter of fact, this morning I had a conversation with a partner in another city to essentially coordinate on a detraction project.
Great. I appreciate that. Thank you.
Yeah.
Thank you, Commissioner. I don't have any questions or comments.
Thank you.
Miranda, do you have anything? Once again, well done, sir. Thanks. We'll move on to the next department.
Next is Extension.
Hi there, thank you. My name is Andy Weekland, the Business Operations Manager for Extension. I'm sitting in for Carrie Weiner, our Director. So thanks for having me, Commissioners. Appreciate it. Just want to go over a few of the things that we're really proud of with Extension and some of our graphs that we have here. First one is in regards to our farmers market program, which I'm sure everyone is familiar with. Big increase year over year from 2022 to 2023. And we've actually seen a pretty good trajectory over the last 3 years. I think last year especially, the weather plays a major role in kind of how the market is. Last year we had some really good weather, not as many windy days or snowy days or smoky days like we have had in the past. So that contributed to an uptick in sales. And over the past 3 years, I also want to mention that I think some of the reasons why we've seen an increase is just some more opportunities in regards to some grant funding. We have worked with, and you'll see this in our next graph too, with our nutrition assistance program, our SNAP dollars. We've worked with state to supplement some of those dollars at the market. So that's really generated some also some more revenue, but also some more foot traffic at the market as well. So some really good successes with our market. And then on the back end, we have a new farmers market coordinator this year that took over, and we actually moved that position to a full-time position just because of the need. We saw that the increase in our sales and just our overall capacity needs for that position. So really happy to bring on Maggie Switzer, who was replacing our other market coordinator who we promoted internally to a new position, our 4-H coordinator, Rachel Wildman. So it's something we're pretty proud of, keeping our talent in-house, and then also being able to attract new talent with Maggie as well. So our next slide, you can see our supplemental food nutrition assistance program, an uptick in our kind of steady year over year. You'll see in 2020, you'll see that kind of our dollars collected went up. And again, I think that was in regards to our opportunities that we took advantage of in regards to our Double Up Food program that offers up to $20 match per SNAP for every SNAP dollar that's taken out at the market. And so I think that program is an annual program. It's not necessarily guaranteed, but the last 3 years we've been able to take advantage of it.
And if I may, I would like to add that we are going to be seeing more of a decrease here, unfortunately, because of the federal stopping of the supplemental to the supplemental. The enhancement to the supplemental nutrition assistance program that happened during the pandemic and the recovery years subsequent. But all households that were receiving SNAP benefits saw a decrease, and some people saw elimination of their eligibility for the program. So unfortunately, that will translate into some decreases in the farmers market, hopefully not commensurate with the increase you saw in that big space between 2020 and 2021, but there will be some leveling off, and that is due to the eligibility changes at the federal level.
Thanks, Laura. Yes, Commissioner.
Thank you, Mr. Chair. This is just me thinking out loud, and I apologize for that, but I'm very curious. We talk a lot about this when we toured the food bank with Congressman Neguse a week and a half ago, and they gave some money. We heard from the food bank about the 30% immediate increase in need. that they saw when the benefits ended. And so I'm wondering, has anyone in our office or tried to put a graph and overlay when those benefits ended, or the amount of, what the amounts were and when that ended, and the increase at the food market and also increase at the food bank and our services? And I'm wondering if we could pull that all together, and even with the older adults work services, and have that as a some kind of graphic to share with our federal partners, so they can understand when we talk about the WIC, and that's overlapping with the WIC program as well. I think that would be, we've been talking a lot with some of those of our colleagues and our partners in serving our constituents, and if we had some kind of graph or some kind of information to pull together to show kind of the confluence of changing variables on kind of a perfect kind of storm. I was hoping that maybe we have something like that, or maybe we could look at pulling something like that together.
So thank you for that question. I do think that would be a nice snapshot to be able to provide to a number of different funders and partners. I don't believe anything like that exists at this moment, but we could certainly pass that request of the board along to probably our Human Services Director as the beginning point, since that is the source of all of the SNAP eligibility and enrollment data. And then from there, maybe take a look at what other major community partners and partner programs such as WIC, the Women, Infant, and Children program that runs out of our Public Health Department, and see if there could be some collaboration around the impacts of that cliff effect that we had in SNAP.
Thank you.
Would you like to continue, Andy?
Yes, thank you for the questions. Moving along to our third graph, our third metric, master gardener hours. Again, have stayed steady. There's been a bit of a focus this year on quality kind of over quantity, but you can see that our metric still has been increasing, just getting more traffic from our citizens coming in, and especially during the summer when we offer our in-person master gardener hours on Tuesdays and Thursdays, we seem to be increasing our foot traffic and able just to connect with the community, answer lots of questions in regards to any of their horticulture needs. We'll see a lot of questions around trees and lawns, especially just depending on what type of year it is. But and our master gardener team in general is very qualified and has been around a long time, and that program is continuing to strengthen year in and year out. So just a good uptake, but also just a focus on quality too, on some of the questions that we've been able to answer. And then moving into our last slide, our 4-H participation, who completes our 4-H program. Again, pretty steady and consistent. Driving it's at 87% last year, but with our new coordinator, Rachel, we've been putting a lot more focus on kind of feedback from the community. The requirements for completion are mitigated by the state. So in-house, what we're doing to try and support the 4-H community is just making sure that we, this year, especially with Rachel, she's holding events and also informational sessions so that she can help deliver on those expectations and those completions of 4-H. And then also, lastly, we have recently conducted a 4-H survey to our community to try and gather some more information on how we can be more effective and how we can meet the needs of the 4-H community. And I don't have those results, but those results are they're coming in and being analyzed, and we'll be using those to really show how we can support the 4-H community better. And with that, I'll turn it over to any questions you may have.
Thank you, sir. Commissioner Stevens, do you have any questions or comments,
I have
perhaps?
probably a couple comments. I'm the liaison to the Extension Board, and so we've been we've started going to communities to sort of share some of this information, but also gauge their interest in some of the programming that's offered through Extension, because a lot of community members don't really know the breadth of programming that Extension provides. So I think that's been great, Laura. We were together in Estes Park, and Estes Park, their town council was very interested, had a lot of great questions, a little less so in Timnath, But, maybe as they get to know us, they'll have more questions. But anyway, just wanted to share that we are going out to really seek some guidance and pass along information so that Extension is not the most hidden gem in the community. And then, with regard, I appreciate Rachel's efforts in the 4-H participants and how to get people to completion, because I think that's tricky, especially with younger 4-H members and first-year 4-H members. There are a lot of requirements to complete a project in 4-H. It can be really complicated. There are a lot of deadlines there and requirements on what your poster size should be. And, so I think that can be intimidating, and, you're trying to push your kids to do this work in the summer, and it can be very tricky. So I really appreciate, Rachel, I saw that she had a program on how to do your posters. So, and printing services available, because like a lot of projects require a poster board. And that can be, there again, the size is, what size do I need? How do I print this material out? What kind of things should be on this poster board? So I have noticed that she's offering those services, and I think those will go a long way towards completion for 4-Hers. So I'm really grateful that she's doing some of that work. There was a record book workshop as well, too. The kids have to do a record book workshop, and that includes some financial information. How much did you spend on your project? What was your return on investment? I mean, this is not easy stuff for 8 and 9-year-olds to do, and so I appreciate the extra efforts in that space. Thank you.
Thank you, Commissioner. Commissioner Shattuck McNally, anything? And I'll have to go. Please excuse me.
I appreciate Extension and our partnership. Certainly, I agree with Commissioner Stevens' comment that it is a hidden gem, and certainly a lot, and I know a lot going on there that the community can really benefit from. Like I said, I've always appreciated Extension, and some of the master gardeners came out to evaluate the bugs I had in my farming. And I thought they were bad bugs, trying to evaluate, well, do I need to do something? And no, but they're so excited that I had these certain kind of bugs that they took some with them. Bagged them, of course, and took them safely. But I think it's a really great opportunity to share that, and I'm just really excited about the potential partnership between the Colorado Forest Health Council and Extension with this workforce capacity for natural resources and forestry, and hopefully the legislature will look upon that favorably. But certainly that's another potential way that we can connect, and I just want to say thank you and appreciate the partnership. It's really not very many organizations have that infrastructure in all 64 counties, and I think it's something that is undervalued and maybe not well known, but it's certainly, I'm really grateful for what we do here with you all in Larimer County. Thank you.
Excellent. Yeah, and if I may.
Yes.
This, like I said, this is just a kind of a quick snapshot of some of the programs within Extension, but like the commissioners were leading to, there's a lot of other things that we're proud of, and we have a lot of interdepartmental relationships that we're working on, like, for example, our food safety and nutrition program that we working with the health department because we saw a need within the community coming to certify managers throughout the community. And Extension was able to play a role in that, and hopefully a continued role. But lots of different programs outside of these metrics exist, and I think next year we may be kind of changing some of the aims and indicators of what we're tracking, just to try and give the community a better idea of where the different types of where we're impacting the community and where we are, because we don't want to be the best kept secret anymore, right? We want to be able to take advantage of where we're impacting the community, and so just wanted to say that quickly.
Yeah, thank you very much. I appreciate that. So I think for time's sake, we'll move on to the next item, which is health indicators.
While Tom is queuing up, can I just give another kudos to the Extension Office? One of the things that you all do is you help county departments with, I think the master gardeners really get engaged with where we plant things and what we plant and how we plant. Most recently at our Livermore Fleet Shop, we had a difficult time with some vegetation there and trying to get some trees to grow. And so that department was able to come in and engage Extension. So they do a lot of work inside the organization and outside in the community. I think you add a lot of value. And please go back and thank your master gardeners for their time.
Yeah, thank you. One of whom is Frank Lancaster, who's on the Estes Park Town Council and was a former county manager. And so a lot of connections in Estes Park as well. So, thank you. I think, Tom, you're up.
Yes, good morning. Tom Gonzalez, Public Health Director. I also got Dr. Jared Olson, our Senior Population Epidemiologist. He's the one that dives in this data daily, so he can correct me when I'm wrong. We've got health indicator. We got 2 pages. We got health indicators and then public health indicators. Our the health indicators just shows that our agency plays a role in addressing the concern, but at the same time, these public health issues involve a number of factors, and many of which are beyond the direct control of the public health department. However, as health strategists, we want to have the data and convene partners to strategize on ways to provide better health outcomes. The first one here you see is salmonella incidence per 100,000 residents. This is a good indicator. It's a bacterial enteric, which means it's a foodborne, waterborne disease. It shows in countries where you don't have the infrastructure, the public health support, it's a lot higher. You're going to see that incidence way higher. It's considered a diarrheal disease. We try to keep that lower. We want to keep that goal under 12. You can see it's been bouncing around. We saw a modest increase in 2023. It went up 72 cases from 62 in 2012. What I'm learning from our team is most of these were travel-related cases. More people traveling around the world, so bringing salmonella back. What that does is it increases our communicable disease team's work on investigating these cases because they are communicable. So we're making sure if we don't have a restaurant worker sick with salmonella or a child care provider sick with salmonella until they have the proper treatment and are excluded. So a little bit of work there. You saw in 2021 we popped up a little bit. It was a multi-state seafood salmonella outbreak, if you all recall. We had over 90 cases in Colorado and 16 in Larimer County, so that contributed to that. And the big one back in 2018 was a local retail food establishment, a restaurant, where we had a salmonella outbreak, unfortunately. So we watched this trend, partly due to our food safety, water safety, and then our communicable disease work. Then our next one is percent of high school students using e-tobacco products. When you look at this graph, this is a huge community success. Under 10% of our high school students report using vape products in the last 30 days. This is part of the Healthy Kids Colorado survey that's administered every other year. We have seen a big decrease in e-tobacco use. Now there's policy work here, and that's where that public health becomes with policy. Part of that is due to the legal tobacco purchasing age changing at the federal law from 18 to 21. And in part due to our localized education campaigns. We do have a tobacco prevention group at the health department working on educating our youth on vaping is not safe and nicotine on a developing brain and the health effects with that. But wonderful collaboration with our 3 public schools and our private and charters, getting this reduction down, plus many of our nonprofits that are working in this area. We still have some challenges with over 50% of the remaining students who report vaping do so because a friend or family member also vapes. So that's very influential. So this presents opportunities for family-oriented prevention and cessation and addiction to youth sensation. So while we're seeing an incredible reduction, there's still work to be done in this area to get nicotine out of the hands of our youth. National Ozone Standard Compliance. I know commissioners and the Board of Health, we've been informing you over the last 2 years in great detail over ground level ozone. You see in 2023, our Fort Collins West Monitoring Station continues to measures out of the federal compliance for the National Air Quality Standards, just slightly. Now, you remember this is weather conditions. Ozone is driven by the combination of nitrogen oxides and volatile organic compounds mixing with sunlight and warm days. Then we get O3, the development of ozone at ground levels. Once it gets above 70 parts per billion, we're out of compliance. So last year, recall we had quite a bit of rainy, cooler days, so ozone was less. The year before, much different, kind of like this summer, dry, hot, less wind, so our ozone was considerably higher. So those mild temperatures did play an impact last year. We really appreciate the partnership with the Board of County Commissioners and the Board of Health, definitely the resources the Commission's given us on working on ways to reduce ground level ozone, and that's We've been beefing up our compliance team, so we're doing more inspections. We're making sure industry's in compliance, whether that's a permitted stationary structure or a small, minor stationary permitted establishment. We're also working with lots of education with the community on how we can prevent ground level ozone. We're doing the mow down program, which is very successful. Now we're moving that to commercial lawn equipment. I like to say this, and I know Commissioner Stevens says it quite often, and it's important to hear this. When you mow your lawn, like today at 1 o'clock for an hour, it's like driving your car from here to Grand Junction. The amount of precursors to ozone is pretty considerable. So a day like today, don't mow your lawn till after 5 o'clock. Plus, it's too hot to mow out there. So we can continue to work on that. Our goal is every year to get it under 70 parts per billion. So I'll stop and pause on the health indicators to see if there's any questions.
Any questions, Commissioner?
Thank you, Madam Chair Pro Tem. So Tom, I see we have the CSU monitoring station and the Fort Collins West monitoring station. It is the news center, our station at Bethke is now online, so it will start collecting starting in the middle of for this year going forward, or will they wait to kind of start as the baseline for 2025? And is that on the website so we can kind of look at that data as well? Just, I'm saying this for the public as much as myself, so.
Yeah, thank you for the question, Commissioner. Our new Timnath regulatory monitoring site, thank you again to the commissioners, and our ribbon cutting event back in June was wonderful. The Colorado Department of Public Health and Environment Air Pollution Control Division is used, the system's up and running. They're making sure it's calibrated. We're told by the end of July, that's now, it should be able to be online here soon, and then we can start using that as another indicator. As well as we have one being built in Loveland at the park there. That won't be till next year, but all in all, we should have 4 to 5 regulatory monitoring sites throughout the county, which is going to provide us much more information than just 2 located in Fort Collins. So hopefully, to answer your question, anytime.
And so both the 4 or 5 will be up by the end of the year, just to clarify?
Yes.
Okay, thank you.
Yeah, I'll just make a couple comments. First of all, I was pretty excited that Dunn Elementary, I think, in Fort Collins will be doing a anti-idling program with regard to ozone. So they're going to start that. It sounded like this fall. So that's pretty exciting, because I think about idling is also a big cause of those high ground level ozone rates, and you think about little lungs around those idling vehicles when people are doing drop off or pickup. It's not great, and I don't think anyone's intentional, but just to sort of build awareness that that's not good for anyone for that to happen. And so I'm encouraged by the fact that a lot of people are getting on board with this work. And so I think that I'm appreciative for you to lead the way on that, and thankful for that. And I think that people are becoming more conscious of that with all the high ozone days that they've seen, especially in the past month, and that will continue on at least through August and maybe extended into September. So, and just wanted to say that in that space, I serve on the non-attainment area air pollution mitigation enterprise, so I do a lot of work on ground level ozone, because I'm also on the RAC too. And we will be having grant dollars come out for the transportation sector, so these will be kind of small dollar grants, probably in the $1 million range, maybe a little less in some cases, for transportation related projects. Those grant dollars will be coming out in the fall. They'll be roughly, I think, close to $30 million worth of grants that will be funded. So I would say for our transportation partners, think about applying for those grants. The grants would have to show that they not only reduce ground level ozone, but that they also improve lives for people who live in disproportionately impacted communities. Yes. But that they, think, so when we think of these small grant projects, we think of sidewalk connectors and bike lanes, and so things that are transportation related. But just want to put that out there so people can start thinking about how our communities and regionally we can access some of those dollars. So That's all I have. So we'll let you move on to your next set of slides.
Wonderful. So these are our public health indicators that we have much more of a role involved in directly. The first one is our measles, mumps, rubella immunization rate for children 19 to 35 months old. This became a concern during and after the pandemic as we saw those numbers declining pretty considerably in Larimer County and the state, as you see back in 2022. And folks, one measles case, and those that are around that measles case, we learned all that called contact tracing with COVID. We all thought a 14-day quarantine period was bad. Measles is 21. So this would have a devastating impact on our economy and our ability to get kids in school and keep kids in school and learning. So we, last year, with the Board of Health, embarked on a big campaign. You also see the State Health Department, you see the commercials, hopefully both in English and Spanish and other languages. But our team has been working over the last 14 months aggressively on doing quite a bit of activities to get those rates back up. What we were hearing is many parents just got behind on their child wellness visits. And so that was working with our local physicians and providers to get those text message reminders out to get kiddos back in. We also did that. Over 3,000 text messages from the health department to remind parents to get their kiddos in. So we've seen a drastic increase in that rate, getting us back up to 91.4%. The state average is right under 91, so we're working together. Governor Polis's wildly important goal is 95%. We appreciate that. So we're going to continue this campaign through next year as well because we've got some work to do. If we can get it up to 95%, you've all heard herd immunity, we are much closer to that where it would be much difficult, even if we had a travel-induced case into our community, that it would spread because of immunization. So that's really, really important. And also put a plug in, our team is working hard to pop up clinics and provide clinics on weekends and nights to more equitable, getting ready for back to school. We're working with our schools that want to participate to do clinics, and those clinics are provided in Fort Collins, Loveland, Estes Park, and other places as well. And Jared, am I missing anything on that data set? Because I think I am.
No, that was a very good coverage. I'll just point out, this is children 19 to 35 months, so this is their first MMR shot. That's a group that we don't have as consistent contact with because they're not yet school age. So this is one where we're really heartened to see that pop back up because we know that partnerships with our school nurses and our school districts is very effective at bringing kids in and having conversation with families in order to ensure that they are in compliance.
I knew I forgot something. That was it. Thank you, Jared, because that's a good, important point. Moving along, it's a number of our consumer health protection inspections. This is environmental health. These are our environmental health specialists that are conducting inspections at all of our over 2,000 retail food establishments, which is restaurants, mobile units, school cafeterias, grocery stores, et cetera. We know that once you get more than 2.76 high priority violations, that establishment is at a high risk to cause a foodborne illness. So our staff are visiting these establishments, working closely with the industry, as well as our friends over Economic Health, and as well as CSU Extension to make sure they're properly trained in food safety. Thank you to you too for that. And our efforts continue to work. We're down at the 1.8 to 2.0 high priority violations per establishment, so way below that goal. We'd like to even see this get lower, and we're going to continue those efforts. But that's a good sign when that's low. It's safety in Larimer County, and we're proud of that program. We also look at the number of consumer protection inspections, and so they're in not only retail food establishments, they're also in our 157 schools that we have, when we have private charter and public schools, our child cares. So you'll see our inspections from 22 to 23 for our retail food went down from 1,670 to 1,362. But the full story is you got to look down below. We were able to increase our child care inspections in schools, very important inspections to make sure our youth are safe. As you see in 2021, due to the pandemic, we were not going into our schools doing inspections at that time. So we ramped that program back up. So they spent much of last year really focusing on the critical issues going on in childcare centers and schools to prevent outbreaks there. But I've been told by our wonderful environmental director, Chris Manley, that our numbers for retail food establishments are high like they were in 2022, so things are going well. But that's our three indicators, and I'll open up for any questions.
Thank you, Tom and Jared. Appreciate that. Commissioner Shattuck McNally, any questions?
Thank you, Madam Chair Pro Tem. I first want to just make a comment. I certainly looking at schools, a little bit of, almost doubling of that, but I also still want to make note of the very low number of inspection, consumer protection. So that's how many tours you're doing of all the schools, or is that how many that you have seen a violation? I'm just curious. Are we getting out to, I'm trying to understand what that means.
Thank you for the question, Commissioner. So that number 112, that means we conducted 112 school inspections.
Okay.
So we're out there on site.
So that's great. And with three and plus some little sections of school districts in our, we still are only, we're rotating through every year, so we're not getting every school every year. Is that a safe assumption?
Yeah, we follow a risk-based approach. So our high schools with the chemistry labs, vocational, there's a little more risk there. So we try to get in our high schools once a year. Middle schools, depending on what they provide and offer, but usually they're every 2 years. In elementary, since we're already in the kitchens twice a year looking for food safety, a lot lower risk for that occupational part. So they're once every 3 years on
Okay,
average.
that's really helpful, and it's great to know that you're in the elementaries, like for the kitchen. So I'm assuming all the kitchens are getting twice a year, so.
Yes,
Really
correct.
some kind of touch of the school. So that's great. I appreciate that clarification. And also, when we look at the rates for children, we're taking this from the providers and the health clinics, right? Are you also getting any information or data from some of those nonprofit services helping support, through our Human Services, some of those groups that are supporting young mothers and stuff, and seeing what kind of data they have? I'm just curious about that.
Jared, you can know that
Yeah,
answer.
absolutely. So providers are required to submit any immunizations to the state, and the state immunization record records that. We work with the CDPHE in order to calculate the estimated percentage of children who are currently up to date or immunized. So that's based off of children who've received at least one non-flu vaccination in the last since birth. So this is strictly the numbers that our providers are providing, and we're aggregating it at the state level and then pulling back out the county shots for our residents. We do not, I can't speak to directly the maternal and child health. They have a lot of outreach, and whether or not or to what degree they're able to involve vaccination and immunization education at that. Certainly something I could check on and get back to you.
I appreciate that, and that's great to know. So that really helps me understand where that data is coming from. Thank you, Dr. Olson.
Thank you, Commissioner. So I'm glad to see that these immunization rates are ticking up, because I really have a lot of concerns around misinformation around immunizations. I also know what it's like to be a parent of a young person, and it's hard to get to an appointment on time sometimes for various reasons. So this is a picture of one kind of immunization. What are the other immunizations looks like? Are we seeing, the numbers that are similar for like DTaP and like all the other shots that kiddos need, or are those numbers lower? Are you mostly concerned about this because of the measles outbreaks we've seen across the country?
So I would certainly say measles is a major concern because of those outbreaks, and because we have seen issues with that in other communities, and because of the extended quarantine period. We do also pay attention to DTaP, varicella, and the other childhood immunizations. I would say the one immunization that looks a little bit different than those other child immunizations is HPV, which obviously occurs a little bit later in childhood. So we are aware of all of those. It tends to be, if a parent is interested in catching up on the schedule or interested in continuing the vaccinations for their child, that DTaP and MMR don't necessarily look different to that particular parent. And so they will catch up as indicated by their school, their provider, or some other trusted entity.
The HPV looks low because, is it lower?
Just to clarify, it doesn't necessarily look lower. I'd have to double check the rate, but its uptake is lower generally than childhood vaccines because it does occur a little bit later in childhood, and it doesn't have necessarily the same set window of the recommended CDC immunization time period, and because of its the nature of that vaccine for protecting children for later lifelong illness.
Exactly. Well, I just appreciate all the efforts that you're doing to keep these numbers high, but this is really important public safety in our community, and we need to, counter those messages that say that these vaccines aren't important, or that these vaccines are dangerous in some kind of way, or that they cause autism, for example, because none of that is true. And they keep kids healthy and safe, and families healthy and safe in our community. And so I just really appreciate, I know that that's been a struggle, and I was concerned after COVID that that fear of vaccines or that pushback against vaccines would extend to childhood vaccines. I'm glad that we're all working, including the state, on making sure that we're countering those messages. So thank you for your work on that.
I really appreciate that, and you're right. And we've really talked about that as public health officers, is who delivers that message. And we're learning the trusted message is the family doctor. So we're really working with our providers in our community with information every visit to talk about immunizations. I think that's where we're getting the most success, is when the doctor says, no, let's get our child back up on these vaccines, they're safe. That's when the parents will listen and move along with that and provide whatever information they need at the time, rather than coming from us. So we pivoted a little bit in our messaging and are working with our providers more.
I appreciate that. I work with a group in Africa, and where we have moms who walk for a day to get vaccines at our clinic, and it's because they've experienced childhood illness and death. And so I think we're kind of divorced from that in many ways in our society, but these are serious illnesses. They're not to be messed with. And so there again, I appreciate your work on that.
Thank you.
Anything further? Thank you. Thank you, Tom and Jared. Appreciate your work. So this is our last slide and our last set of metrics, and it is human services.
Good morning, Commissioners and friends. Thad Paul, Division Manager for Child, Youth, and Family Division with Department of Human Services, filling in for Director O'Hare today. So I'll just walk through all 5 of the slides. 2 of the slides are not in my wheelhouse necessarily, but I'm got some little talking notes to make sure I cover those well with you. So the first slide there is the child support paid. Spent on every dollar spent on collection program costs. The spike that is noted there in 19, 20, 21, that was a result of the federal government requiring us to intercept COVID stimulus funds. So that is a direct result of that. We are seeing a continued decline even after that stimulus funds have ended. And much of that is as a result of our cost of business. So our cost of staff goes up, and with that increase in cost and personnel costs, then you obviously have the reduction on how much, the savings or the difference between every dollar spent on how much is captured in those. Is there any questions on that one?
Any questions, Commissioner?
Okay.
I don't think so.
Second slide. So this is percent of parental support cases where funds were collected. A little bit of a reduction since 2019, but we're pretty status quo since that point in time. In comparison to other counties, we're 60 to 64% is kind of the average range for almost all the big 11 counties. So we're very, very aligned with that practice. In calendar year 23, it was of note of 18.5 million was collected and redistributed back to custodial parents. Pretty significant resource and support to those families, obviously. And for child welfare side, that is a mitigating factor, right? That's a risk mitigator, so that's a nice thing to see for us as well. under the leadership of both Deputy Division Manager Nancy Kelly and then Division Manager Vanessa Fuel. They continue to do a lot of innovative work in their child support programming. They've gotten several different types of training, including motivational interviewing, some specialized case management training to help both engage the non-custodial parent, because what we find is that relationship, the work through child support actually helps the relationship between both parents parent the child that they share. So a lot of positive outcomes, not just from a fiscal perspective, but from the child's well-being perspective, is impacted through child support. Also, they've done a lot of really creative strategies. They got a grant that they are now offering a nurturing parent program through child support that our families and child welfare are also able to access. So that was a nice benefit that they were able to succeed with. And they continue to have, continue to engage them in multiple ways. We have a partnership with the Workforce Center in helping to support non-custodial parents and job services. So a lot of opportunity, a lot of work happening, really creative stuff happening in the child support division over at Benefits. Yes.
Could you repeat that 18.5 million?
Yeah, well, I can give you these back.
Is that for the year or?
For the year, for the calendar year of
for-
23.
And that's what's collected?
Collected and redistributed back to the to the custodial parent.
And how many, do we know how many families that was?
I don't have that number.
So it would be, it's of course not one family's getting all of that. I'm just
Right.
curious how many that is. Trying to think about how much per family that
Per
is.
family.
And I know it varies,
Yeah.
but I'm just curious about that. If that's, I'm assuming hundreds, but that's a pretty significant number.
Pretty significant.
In a lot of ways. So I just wanted to make sure I understood that. Thank you.
And obviously that would be big, like some families have multiple children, so there may be multiple amounts per month from each child, right? Yeah.
Yeah, just as that money benefits those families, and it's money that, we might not have to bring to those families because, there's only so much money to go around.
Yeah.
And so, I think that's time well spent. How many staff members do that work?
I
or in
don't know
department?
I don't know the size of that team. I don't know if Laura does, maybe.
I would tell you from at least a couple of years ago, probably between 25 and 30, including supervisors and lead workers. That's about average, I think.
Okay, yeah, no, yeah, so the return on investment for that, these are dollars that benefit these young children and I'm sure that as people get more connected, they are able to maybe co-parent better and
Yeah,
so.
the stress of not being supported by the non-custodial parent oftentimes is a relationship divide, right? So even having a space where you are helping to support your child, then you feel better about your life because I'm supporting my child in another home, and that other home doesn't feel as much frustration maybe from the other side.
Yeah, that's great work, thank you.
So moving on to the next one, percent of children not removed from home after we return them home. So we often call this a no reentry, is kind of how it's classified in child welfare. Been on a positive streak since 2020. You'll see there. This is there's a lot of factors that go into this. Obviously, we had a really nice boom of services available in the community partly as a result of the ARPA dollars and then some of the funding that you guys have been discussing here today through behavioral health. There is some growing concern with a reduction of some funding availability through child welfare about how much service access we'll have moving forward. And the reality is in child welfare, our mantra is services do not equal safety. So it really comes down to really robust support plans and support networks that are built around the family with the family instead of relying solely on services. Moving on, unless there's a question. No? Okay. The next one is percent of children who remain home safely at home per case plan. You'll notice that dip since 2020 is the more significant dip. That was actually a metric change. Prior to that point, if we went out in a child welfare assessment and decided we need to remove a child within the first 30 days because of the safety concerns, then that kind of got scraped off the data. So that was no longer part of the N. That metric changed, so now it is from referral date, did you keep them in home, kind of irrelevant to what happens in that first phase of assessment. So, and it's a good metric because our goal is to, child welfare there's a connotation of what child welfare does, and we go out there and we knock on doors and we snatch babies. Lots of not truths in that one. We can't even take custody without law enforcement or the courts giving it custody. And we have two primary goals: child safety, makes a ton of sense. Second one, keep the children with their families or get them back home as fast as possible. So the best case scenario is we never have to have that removal, and we're wrapping that family up with successful services. That 86, 84, 85%, we are still the highest of the big 11 in this category. Our goal is still 93%. It's a reach goal. It's going to be a hard goal to achieve, I think, in this space, and that is a goal we're aiming for. But I'll leave a little space for questions if there are any on that one.
Jim, Commissioner, go ahead.
Again, just clarifying and making sure I hear this correctly, that out of the top 11 big counties in Colorado, we are at the top for this rate. So 85 is actually it's not meeting our goal. That's our goal of 93.
Yeah, that's right.
But we're the only one that's really meeting 85.
Yes.
And so, I guess an offline question, because, I've been on LICOG with you and all these
Yes.
things. Offline, I'd like to just maybe have just a conversation of how, with the changes in some rules and some other things coming with the state and some of this high acuity care question challenge that we have, I'm curious. I think I know the answer to this, but I'd just like to know what challenges there are for us to get closer to our goal and what we need to advocate for. And I think I know the answer to that, but I'd just like to have maybe some high-level not talking points, but challenges that I feel like I need to remind my colleagues about addressing
Yeah.
to help help us
Yeah.
with this important work, because this is really at a very important time for youth and families. This is generational, could be generational shift.
Absolutely.
Whether it's, bridges out of poverty, but also just, I'm preaching the choir. This is a very important time I just like to understand how we can maybe put a little big push on this after a conversation I had this morning online, so.
Yeah, happy to have any conversation to help inform or discuss. I'll take this opportunity to maybe highlight a case. So just this last weekend, we've had a 15-year-old girl that we had in one of the state beds, so the PRTF, one of the highest level of state beds. About a month ago, they discharged her because they said she wasn't meeting progress. And really what that meant is they were still having to restrain her on a regular basis, even in our highest level of care. The challenge that put us in is we didn't have any placement in the state or out of state that was willing to take those kids' behaviors. And so we've been cobbling together kinship placements, other supports, and the child has been in and out of the hospital multiple times. Through self-harm attempts, right? And so, most recent example, she was hospitalized, Ken refused to take her back. Amazing partnership with Summit Stone and Longview. We were able to use one of their 23-hour beds. If there is a future state of having youth beds at that facility, that would have been a nice addition at that point in time. But she was able to stay for 23 hours. They did a nice assessment, and we still didn't have a placement, and so we were going to have to figure out how do we manage her in an office setting or a hotel. We had ComCorps standing by helping to support. She broke the window in the ComCorps van and started to cut on herself again and ended up in the hospital again that evening. So the high acuity behavioral health needs of our really at-risk kids is really difficult. She comes with a trauma, with a lot of mental health, as well as some IDD diagnosis. So it is kind of the package, right, if you will. So amazing. I was able to get in contact with Dr. Brooks, who was on vacation in Minnesota, and I was up in Wyoming camping, and Summit Stone helped create medical transport, because amazingly we found a placement over in Grand Junction, but we needed how to get her there safely, right? And I didn't want my staff parked on the side of the road because she's having some event. So we had 2 staff from Summit Stone and 2 staff from DHS helping to transport the child over to Grand Junction to a placement, and she's still in the home today, so fingers crossed. But I kind of highlight the partnership it takes to keep kids and families well and safe, and the high acuity crisis is a real thing in child welfare still.
Thank you for sharing that. I think I heard some pieces of that story. So when it comes down to that, the blending of funding, the pay for all of that, which is exorbitant, is that coming mostly from us as a county, or are we getting any support through? I know I could list the things, but you know what I'm saying? And because that was a conversation we had again this morning, is how do we piece together, so, because that's a lot of other counties wouldn't have those resources, we're fortunate.
Yeah.
But you know what I'm saying, it's just, that ends up being a pretty expensive.
Yeah.
I don't think people understand how trying to take care of these folks, it just
is.
really adds up. And not that it's important to take care of folks, but because we have to transfer it so far and having the state maybe address, something. Again, I probably should have this conversation offline, but I'm just, this is because I had a conversation this morning, this is fresh in my brain, so.
Yeah, main funding source would be the child welfare allocation, but within that is state, federal dollar, and then a county match, right? And then not even counting what Summit Stone offered and provided, or Longview, through the Longview campus, behavioral health services. And now we have yes, we have a placement, hooray, it's 5 hours away, right? So us getting there on a regular basis to do really good casework is near impossible. So then we have to partner on with other counties to help cover those visits and things potentially as well, so,
Thank you.
yeah.
Thank you, Thad. I think that's a really good illustration of what high acuity and the kind of work that your team does on a daily basis. So we're appreciative, and we know that some cases are just, there are cases that are so severe that children can't remain at home, and so that's a good reminder to us. It looks like you maybe have one more
Yeah, one more.
metric?
The last one is percent of children who do not experience maltreatment within 6 months of case closure. So this is, we've closed the case. They didn't have to come back with us to have a new assessment to determine whether there was some allegation. We've always been a leader in this category across the state, and take a lot of pride. Even our intervention is intended to be a prevention effort, right? So even when we have to intervene, in theory, if we're doing our work our very best, that child and family never has to come back to child welfare. So that's kind of what that indicator would be.
That's definitely the goal. So I appreciate that. I don't think I have any further questions. I will ask Commissioner Shattuck McNally if she has any questions on this last metric or anything else.
No, I'm sorry for the interruption, I'm just watching a smoke from my house, so, sorry, thanks.
Okay. So Lorinda, anything to close us out?
I guess I'll just say, this is one of those service areas that really supports the community. You see these measures, these are just the tip of the iceberg of the kind of work that these folks do every single day. This is our safety net for our community in a large part, and so I guess thank you for all you do to make that happen, to set the bar really high. You all do that. It was interesting to watch. You could easily move that bar down and make that line green, but that's not where you want to be. And so I hope the community sees that as well, the kind of resources and effort and frankly, all of your hearts that go into this work. So Laura, thank you for leading this team and for helping this group kind of get these measures squared away. And I think, Julie, you've got some work you're going to be doing over the next year to make these maybe even more demonstrative of the kind of work that they do.
Thank you, Lorinda. I would just echo that. When we talk about taking care of our community, you guys are on the front line, so I appreciate all the work you do, and then coming back to let us know what you're doing and how well that's working. So that continuous improvement is really just something that I admire you. And these are big things to tackle. Oh yeah, I'm sorry.
No,
Laura Walker,
that's all right.
please.
The one thing I just wanted to add that you will be seeing in the coming years, we have our Housing Stability Program Manager, Leah Rodriguez, has joined us in the peanut gallery, as I call it in this room. But we will have measures for our housing programming coming up in the next cycle as well. So more to come on that topic.
Oh, I appreciate that so much, and thank you, Leah, for being here. And that's obviously something that we hear about a lot in our community, is housing on all different kind of economic levels. So we will look forward to seeing those metrics in the future. So I think that we have covered everything, and appreciate everybody again coming out and sharing this information with us. It is 11:29 and we're adjourned. Thank you all.